Welcome to Fila Health Systems of NC's Health and Safety Training. This training reviews Section 1H of PHSNC's Policy Manual and explains the responsibilities, procedures, and expectations that help us maintain a safe, respectful, trauma-informed, and person-centered environment. At PHSNC, health and safety are not simply operational requirements. They are part of our mission. We provide compassionate, clinically sound behavioral health services that support individuals and families as they work towards stability, recovery, independence, and a meaningful quality of life. Every safe decision we make helps protect the people we serve, the staff who provide care, our families and supports, our visitors, and our community partners. Safety helps us fulfill our promise of helping you live your dreams every day. PHSNC serves individuals and families who may be navigating trauma, behavioral health challenges, substance use concerns, family stress, court involvement, community barriers, and complex life circumstances. Because of this, our service environments must be safe, respectful, predictable, and supportive. A safe environment allows people to participate in services with dignity. It allows staff to provide care with confidence. It helps families and stakeholders trust that PHSNC is prepared, organized, and accountable. Health and safety at PHSNC includes facility safety, infection control, emergency preparedness, incident reporting, medication safety, violence prevention, sexual violence prevention, environmental safety, community-based service safety, documentation, and performance improvement. Everyone has a role in safety. This includes leadership, the safety officer, supervisors, clinical staff, administrative staff, volunteers, contractors, persons served, families, and visitors. Health and safety protect everyone and support person-centered, trauma-informed care. PHSNC is committed to maintaining environments that meet applicable legal, regulatory, accreditation, health, and safety standards. PHSNC's health and safety procedures focus on identifying risks, monitoring and evaluating safety conditions, reducing or eliminating unsafe practices, preparing for emergencies, supporting regulatory compliance, and promoting the health and well-being of everyone involved in PHSNC services. This means safety is not limited to one department. Safety must be built into daily operations, service delivery, staff meetings, training, incident review, documentation, and leadership oversight. PHSNC's health and safety program includes prevention, monitoring, reporting, investigation, corrective action, education, training, emergency preparedness, and performance improvement. When staff see a safety concern, the expectation is simple. Correct it if it is safe to do so, report it if it cannot be corrected immediately, and document it when required. PHSNC leadership is responsible for ensuring that health and safety policies are implemented and monitored. The Chief Executive Officer has overall responsibility for health and safety management. The CEO ensures policies are approved, risk management issues are reviewed, critical incidents are addressed, regulatory requirements are followed, and resources are available to support safety improvements. The Chief Compliance Officer assists with monitoring, reporting, investigations, corrective action, compliance concerns, and unresolved safety issues. The management team reviews inspection findings, drill outcomes, incident trends, corrective action needs, training needs, and opportunities for improvement. The safety officer coordinates site-specific health and safety activities and helps ensure that safety policies are carried out in daily operations. Together, leadership and staff create a culture where safety concerns are taken seriously, incidents are documented, corrective actions are completed, and lessons learned are used to improve services. The safety officer plays a key role in PHSNC's health and safety program. The safety officer is responsible for maintaining the facility or organizational safety binder, coordinating annual external inspections, ensuring quarterly self-inspections are completed, coordinating emergency drills, supporting health and safety training, and maintaining documentation of safety activities. The safety officer also reports inspection results, drill results, safety concerns, corrective actions, and recommendations to the appropriate committee, CEO, administrative team, management team, or leadership designee. The safety officer's responsibilities include maintaining the safety binder, scheduling and coordinating annual external inspections, ensuring quarterly self-inspections are completed, tracking corrective actions, coordinating emergency drills, completing drill reports, educating staff after drills, supporting initial and ongoing safety training, reporting trends and recommendations to leadership, and supporting IRIS reporting when applicable. The safety officer coordinates safety, but everyone is responsible for safety. Who is responsible for maintaining the safety binder and coordinating key safety activities? The safety officer or designated staff. The safety officer or designated staff member is responsible for maintaining safety documentation and coordinating key safety activities. Each PHSNC program site must maintain a safety binder. The safety binder is the central location for required safety documentation. The safety binder should include all applicable safety policies, a yearly safety activity grid, external inspection reports, internal self-inspection reports, emergency drill procedures, completed drill reports, incident reports, safety meeting documentation, corrective action documentation, and copies of health and safety policies. The safety binder helps PHSNC stay organized, prepared, and accreditation ready. It also shows that safety activities are not just discussed, but documented, reviewed, and followed up on. Documentation must be complete, organized, current, and maintained in a secure manner, especially when incident reports or confidential information are included. External safety inspections must be obtained at least once per year at applicable locations. External inspections may be completed by recognized and competent external experts, such as the fire department, an insurance representative, a safety consultant, local government inspection personnel, or another qualified safety professional. The purpose of an external inspection is to provide an objective review of facility safety. The report should identify the areas reviewed, any areas needing improvement, recommendations for improvement, the inspector's information, the date of inspection, and the criteria used for the inspection when available. The safety officer is responsible for coordinating the external inspection, obtaining the report, clarifying recommendations, placing documentation in the safety binder, reporting findings to leadership, and tracking corrective actions. Inspection findings should be used to improve safety, not ignored or filed away without review. PHSNC conducts facility self-inspections at least quarterly. Quarterly self-inspections help identify safety issues before they become larger problems. The safety officer oversees this process, and designated site safety representatives complete the inspection checklist for their assigned facility. Self-inspection reports must be submitted to the safety officer, reviewed by the appropriate committee or leadership group, documented in meeting minutes, and maintained in the safety binder. Self-inspections review environmental safety areas including entrances and exits, evacuation maps, fire extinguishers, smoke alarms, first aid kits, emergency lighting, phones, bloodborne pathogen supplies, room temperature, plumbing, hazardous materials, restrooms, kitchen areas, equipment, electrical areas, storage areas, floors, furnishings, air quality, stairways, exterior areas, grounds, and parking areas. Every staff member and volunteer is responsible for helping maintain a safe environment. Staff and volunteers must follow all health and safety policies, perform duties safely, use proper hand washing, follow infection control and universal precautions, use personal protective equipment when required, store and use chemicals safely, no emergency exits, participate in drills, and report safety hazards or incidents promptly. If staff see an unsafe condition, they should correct it immediately if it is safe and appropriate to do so. If it cannot be safely corrected, it must be reported to a supervisor, safety officer, chief compliance officer, or other designated leadership. Staff must also complete required documentation including incident reports, drill reports, inspection reports, or compliance reports when applicable. Do not ignore hazards. Correct, report, and document. PHSNC's health and safety policies include several key areas. These include external safety inspections, internal self-inspections, emergency and disaster plans, emergency drills, safety information sharing, first aid equipment, critical incident reporting, tobacco use, client medications, infection control, universal precautions, biohazards and bloodborne pathogens, first aid training, vehicle safety, home and community-based service safety, fire safety, workplace violence prevention, weapons prohibition, de-escalation, sexual violence prevention, drug-free workplace expectations, and medication safety. These policies work together to protect people, reduce risk, and ensure services are provided in a safe and professional manner. PHSNC prohibits dangerous weapons on company property, in company vehicles, and in any service setting under the control of PHSNC, except when carried by law enforcement acting in an official capacity. Dangerous weapons may include firearms, explosives, biochemical threats, knives or blades intended or capable of causing harm, tasers, clubs, batons, objects used to cause bodily harm, and aggressive or assaultive physical behavior. A concealed carry permit does not override PHSNC policy. If staff become aware that someone may have a weapon, they should respond based on the level of risk. Staff should not attempt to physically remove a weapon. If the situation is volatile, threatening, unsafe, or likely to escalate, staff must remove themselves and others from danger when possible, notify leadership, and contact law enforcement or emergency services. The priority is always safety. Do not attempt to remove a weapon. Create distance, alert leadership, and contact emergency services. PHSNC is committed to a workplace and service environment free from violence, threats, intimidation, harassment, aggression, and unsafe conduct. Staff must use trauma-informed communication, avoid escalating language, maintain awareness of personal safety, seek support when needed, use de-escalation strategies when safe, and contact emergency services when there is an immediate risk of harm. PHSNC does not use restraints of any kind. In emergencies where de-escalation is not effective or the risk cannot be safely managed by staff, emergency services or law enforcement must be contacted. De-escalation is important, but personal safety comes first. Staff should never put themselves at risk in an attempt to calm a situation. PHSNC has a zero-tolerance policy regarding sexual violence, assault, stalking, unwanted touching, exhibitionism, verbal harassment or abuse, physical threats, intimidation, and any behavior that places others at risk of harm. This policy applies to staff, volunteers, contractors, persons served, families, visitors, vendors, and stakeholders. It applies on PHSNC property and PHSNC vehicles, during community-based services, during work-related travel, and while using PHSNC resources. Confidentiality and privacy must be respected to the extent allowed by law, and to the extent that maintaining confidentiality does not place anyone at risk of physical harm. PHSNC will not retaliate against any person who reports an incident or against a survivor who requests leave, reasonable accommodation, referral support, or safety planning. If sexual violence or threatening conduct occurs, the person should remove themselves from the situation as soon as possible, call for help, ask someone to call 911 if needed, notify leadership when safe, seek medical attention if needed, preserve evidence when possible, and complete or cooperate with required incident documentation. PHSNC also uses a discrete notification procedure for threatening situations. If staff need help but do not want to alarm or escalate the aggressor, they may call the front desk, a coworker, supervisor, or designated point person and say, "Could you hold all my calls?" This means staff assistance is needed immediately. If law enforcement is needed, staff may say, "Could you cancel my next appointment?" This means staff assistance is needed and police should be contacted as soon as possible. PHSNC is committed to maintaining a healthy, safe, respectful, and productive environment. The use of illegal drugs, misuse of legal drugs, misuse of prescription medication, or abuse of alcohol can impair judgment, reduce safety, interfere with service participation, negatively affect job performance, and create risk for staff, persons served, volunteers, and visitors. Staff and volunteers must report to work fit for duty and remain fit for duty while performing PHSNC business. Persons served and visitors are expected to participate in services free from intoxication or impairment that creates a safety risk or interferes with service participation. Use, possession, sale, distribution, trafficking, or manufacture of illegal drugs is prohibited on PHSNC property and during PHSN business. If illegal drugs are brought into a PHSN facility, staff must not confiscate, hold, transport, or store the drugs. Staff must notify leadership, contact appropriate authorities when needed, and complete a critical incident report. PHSNC is not responsible for medication management unless a separate written program-specific policy says otherwise. Staff do not store, hold, administer, prescribe, dispose of, or control access to medication for persons served. Persons served are responsible for maintaining possession of their own prescription and over-the-counter medications while in the PHSNC facility or while participating in PHSN services. Medication should remain in the original container, safely secured, out of sight, and in the possession of the person it belongs to. PHSNC staff do not hold, store, or administer client medications. Accurate and timely incident reporting is essential to safety, compliance, and quality improvement. Staff and volunteers must report all safety and security incidents in writing no later than the end of their shift, unless emergency circumstances prevent completion within that time frame. Serious incidents must also be verbally reported to the appropriate supervisor, safety officer, chief compliance officer, human resources, clinical director, or CEO as soon as possible. Authorities must be contacted within 15 minutes of discovery or as soon as safely possible for certain critical incidents such as physical or sexual assault, assault between persons served, serious injury, weapon involvement, sexual violence, or ongoing danger. Applicable incidents involving persons served must also be reviewed for reporting through North Carolina's Incident Response Improvement System, known as IRIS. The safety officer, chief compliance officer, or designated leadership staff is responsible for ensuring applicable incidents are reported through IRIS in accordance with state requirements, payer requirements, contractual obligations, and PHSNC procedures. Level 1 incidents are generally documented internally unless otherwise required. Level 2 and Level 3 incidents must be reported through IRIS when required. Staff should never delay emergency response while determining reporting requirements. Emergency first, report promptly, document accurately, follow up completely. After a serious safety event, debriefing is an important part of learning and improvement. A debriefing should occur as soon as reasonably practicable and should include key individuals involved in the incident. Information should be gathered within the first 24 hours when possible. The goal is not blame. The goal is to understand what happened, what worked, what did not work, what risks remain, and how similar incidents can be prevented in the future. Corrective actions must be documented, assigned, monitored, and reviewed for completion. PHSNC uses inspection reports, drill reports, incident reports, corrective action documentation, meeting minutes, IRIS documentation, and performance improvement summaries to strengthen safety across the organization. Documentation is not the end of safety. It is the beginning of improvement. Health and safety at PHSNC is everyone's responsibility. Remember these key expectations. Know the policies. Follow safety procedures. Use trauma-informed de-escalation. Never attempt to remove a weapon. Do not enter unsafe environments. Do not use restraints. Report hazards immediately. Document incidents before the end of your shift. Escalate serious incidents verbally as soon as possible. Support IRIS reporting when applicable. Participate in drills and training. Respect confidentiality and privacy. Support persons served with dignity, compassion, and professionalism. By maintaining safe environments, we protect people, promote recovery, strengthen trust, and support PHSNC's mission of helping you live your dreams every day. Thank you for completing PHSNC's Health and Safety Training. Please complete the post-test and acknowledgement form. Your participation helps ensure that PHSNC remains a safe, responsive, person-centered, and mission-driven organization.